Come and get started on a new mission, a new direction, a new intention. Welcome to 5.8G Alive at Connections 50 Plus. I am Terry-Ann Joseph Brathwaite.
And I am Jennifer Gibbons Joseph, catering to all your prospects in the third act of life.
Economic well-being, social gratification, personal fulfillment.
Join us on Wednesday at 6 p.m. on Connections 50 Plus Facebook page, YouTube channel,
and on Gael the Caribbean. Good afternoon, good evening, friends. Welcome to 5.8G Alive from Connections 50 Plus. I am Terry-Ann Joseph Brathwaite, one of the co-creators of Connections 50 Plus, which brings you 5.8G Alive. And with me, as usual, my friend.
Hi, good evening, everyone. Welcome. I am Jennifer Gibbons Joseph, the other co-creator of Connections 50 Plus.
Hi. So, Jennifer, we're on a roll. How are you going? Everybody asks me, how are you going? So you have to get a weekly update of how you going.
I am going good. I'm doing well. You know, I haven't started to knock about as yet, so I'm taking it easy.
Very, very good. Okay. So, Jennifer, I'm so excited because we talked last week about friendships and the importance of building that unit around, whether it is for your selfish purpose or whatever reason, getting friends closer. And we talked about our building friendship pods. And I really hope that people have begun to take heed and consider, is this something that they should be doing? What kind of feedback did you get?
They did, because I got some good feedback on that. That it was a great idea, and it would help really. They saw the benefit of having some close friends around, especially to keep you going, to prevent you from that loneliness or lonely feeling that you may have at times. So yeah, I think it was well received. For me, I actually listed, in terms of, I made a list of about 10 friends, and I decided to break down exactly what I was looking for. And then I wanted to ensure that those that I selected for this pod should know each other. I felt there was, because we have friends, and as you said before, in different categories. But I thought for this pod, I wanted persons who would be comfortable with each other, who are custom, in terms of linemen that they may find themselves in that same situation. So basically,
interest. I think interest might be important, huh?
Yeah.
Because you might be linemen with people.
Yeah. So I thought of that, and I was thinking that how I've designed this spot is that, and I moved away from weekly to every other week. And I thought too, it has to be persons who are comfortable going in that other person's home. Yeah. So not everybody, people are very careful who they embrace.
Yeah.
So I added that, and in adding that, I have some very close friends, but knowing they're very private, that they may not like the idea of being in a pod, So, yeah.
But you can also have pods of two. You could also have different pods,
Yeah. Yeah, you can. So, yeah. So we need to, it is important to not just saying that, okay, I'm having a pod, but to really fine tune it in such a way that everybody would be comfortable, you know? Yeah.
Definitely, definitely. I am seeing myself with more than one pod. And I would probably have fortnightly outings, but any pod might be every month and a half meeting. But I'm going to have a
Yeah.
good time regularly. And hopefully, I've chatted with two persons and they thought the idea intriguing, kind of like, ah. But they say, but don't we already do that? And I said, no, this is more intentional. This is more intentional. So yes, we already go out, we talk, but this one is more intentional. The feedback was all positive. So looking forward to that. And Christmas is a good time coming up to introduce those pods.
Yeah.
All right. So Jennifer, today we coming off well, it's not off the pods, but we want to talk about something that's really, really important to us all. How do we face crises that have a financial impact on us, especially when it's related to illness? So we're going to jump into Dollar Saavy and talk some more about that.
Karen, I really come in, I have been referring to the different experiences I've had, surrounding my illness. And finance is really, really how we handle your money. And it's so critical. And also what I have, and from chatting again, having the conversations with friends who called, one friend even told me, Jennifer, if you need help financially, tell me, because I know, at this time, these things cost, and I am aware that if you're not prepared financially for a crisis, yes, in this case may be medical, but we have so many other types. It could cause you so much stress. If it's medical, it could really distress you and make you maybe more ill. It is a worrisome situation. So and actually for me coming out, and I'm still in it because I'm a financial coach also, but coming out of the insurance industry, I am so aware of how important it is to prepare. But for those who, sometimes you say you can prepare and prepare and prepare, but when that time comes, it's different because a lot of things happen. We face a lot of challenges along the way, and a lot of I wouldn't even say small crisis, not crisis, it's a crisis, that can erode our savings and our plans. So my thing is, when you look, for those who actually, we don't know, and like in my situation, you're going along very happy, and then you are faced with a crisis, and you have now to really start to think, what am I going to do? What decisions am I to make? So I would say, even with start, I always go back to our mindset, how we think about things, how we do things. Is that, first of all, we can't panic. And don't care what crisis, for us to make an informed decision, we really cannot afford to panic. Now, it's easier said than done. So, how I suggest
I think we first have to define what is panic. What do you consider panicking to be?
Panic is when you are faced. This is how I looking at this financial situation. Panic is when you have to make a decision, and you are faced with some cost, and you start thinking, oh gosh, where am I going to get that money from? I may not have enough to do whatever it is. And you can be get very, and I would say panicky, but stressed out if you believe you cannot afford to meet whatever expenses that facing you. All right, so we're dealing about the financial distress here, and it happens, and it don't have to be what may be a lot for one may not be a lot for other. It all depends on your situation at that time, because it may be a need for me to find 100,000. And I may say, oh, that's not too bad. I could deal with it. But I may be a little anxious, about it. Another person might be a big stress for them, and they could start to panic because they may think, if I don't get that amount of money, then I would not, and I relating it to medical here, I may not be able to do whatever procedure is recommended to save my life. You understand? So that to me would be a real crisis situation, would relate to more panic than stress. Stress will come after. So that's how I look at it, Terry Ann. You know?
I just quickly went to good old Dr. Google. And I asked, what is the meaning of a panic reaction? And they said it's an acute, overwhelming attack of fear or anxiety, producing personality disorganization that may persist. And I think if we, the thing is acute, which means it's intense and sharp, overwhelming, which means you lose control of yourself, fear and anxiety, which means you're not rational anymore and you're in a heightened state of fear and anxiety are emotional responses that cause you to see the negative of things and anticipate the worst outcome. And personality disorganization. So when you're panicking, you're not thinking rationally. You are not your normal self. And they say it can persist. So if you are having an acute, overwhelming attack of fear or anxiety, and your personality, your normal personality is disorganized, and this is going to be persisting, you certainly are not going to make a good decision in any situation if you choose to stay in panic mode. And I think when we see that explanation and things happen to us, we have to really think, when we are not panicking, about, okay, what is a reasonable way forward? And based on this definition, Jennifer, I think it's very critical for us now that we are not panicked, and I'm not talking about Jennifer and I only, I'm talking about all of us, that we think with our regular, normal personality, So if something were to happen, what is possible?
Yeah, and I mean, you can get a better description than that. So my thing is,
Dr. Google,
each of us, and you mentioned personality, we use different methods to calm ourselves when we are angry or when we are faced with in certain situations. For me, I think to be calm and to start thinking in a more rational fashion, I turn to prayer. I call on God and say, listen, I need to deal with this thing. So I calm myself. Some people may do different things, music or whatever, but we have to find a way to center ourselves in a situation like that. May not be easy, but if you're more aware and very conscious, we do it. Because, as I said, that's the only way for us to start planning what is the next step, or how can we come out of this, or what can we do. So when we reach that, when we can center ourselves, then we have to look at the actual situation we are in. And my thing, of course, it is medical, because sometimes we panic, and when time comes and you get the facts, it's not as bad as we think, You understand? So if we get the facts of that situation, if it's medical, of course, we really want to know what are the options, etc. And when we find all the options with a cost to the option, then we would know, okay, this is the real figure. And if this is the real figure, we then look at our situation, our financial situation or the family situation to know where are we getting this money from? Can we afford in this crisis to choose, if it's medical, to choose private, to choose going overseas, or do we have to use the public system, or can we straddle both? You know? But for us to make that choice and make that decision, we may also need, in some cases, you cannot do it on your own. You need to pull together your loved ones, as I say, the stakeholders, to really come to terms that what do you have? And because you also need to know, so you have that figure in front of you, what will be resolved or solve the problem or the issue as quickly as possible. Then you have to check yourself and be honest and say, what do you really have? Some cases people really don't have anything, you know. Or they believe they don't have anything because they may not have cash in hand, or they may not have a medical plan in hand, you know, or they may believe they don't have any assets. But when you really be realistic about what you have, you may be very surprised that you may not have the cash, but you may have some assets that you could decide how you're going to, whether it's liquidate or what. There are several options you could look at, including those around you who have your interest at heart, who really care. They may come up with some ideas, or they may be able to help out financially. So, but that is, at this stage, you would not be, hopefully not in panic mode, but very open-minded. You know, you have an open mind to what is being suggested. And yeah, and Terry, and you will be surprised that how you could rake in some money, let me put it that way. Yeah.
Yeah, you know, I think that's the panic plan. But I think we can also sit back as we are not panicked and seek information. Seek information. Yeah. We are all 60 plus. Things can happen in life. And as we say so very often, we check our family history. You know, it's probably a good time we're coming down to the end of the year. You're doing inventory. Check your family history. You know, go dig up some death certificates and see cause of deaths. And just go back 2 generations. You know, what did great grandma and grandpa die from? What did great grandma and grandpa die from? What auntie this and uncle that? You know, talk to relatives and just get a sense of what is likely to be brewing if there are hereditary traits. And if there is a trait of something in your family, then now, before you get a diagnosis, as you were saying, you know the probability is high. The odds are not on your side. So the best way, before you get into this disorganized psychological space, is to begin preparing, putting aside some resources, you know, and so many of us, Jennifer, at this stage, and I'm saying the crisis hasn't come, the diagnosis hasn't hit. We don't have reserves. We consume everything. And I think when that kind of news hits you and you have no reserve, and I'm talking about you have no reserve now, I'm saying before it hits you, have a period in front of you where you could try to build some reserve. That at least if we aim every year to build a $5,000 nest egg and just put it down somewhere, at least you have some comfort that when the news comes to you, you could start doing something out of your own means. And I think that's the first, that's where I'd want to start. Before I get the news, I know of my family history. I know what I may be predisposed to. And I start to do a little something for that.
Okay, so Terry, let me go back a bit. And I tend, so you on a very positive road and talking about panic and thing, maybe I'm down on a little more on a negative, but realistic. It's very good, and we always advise, yes, get family history. But you see, when you go back 2 generations, depending on where you are, your age now, don't be too surprised if most of the time the death certificate have old age. That's a thing about old age. But you said something which is important. Questioning, you may not get the exact, but you know, if they just drop down suddenly, or if they ail for a while, or if somebody says something. But we have to be aware. And the other way of being aware, and we mentioned it before, would be doing your annual checks, and your doctor would realize, yes, you may have been diabetic, etc., etc. And with that, definitely you take action. You take an action to prepare yourself through savings, through different type of programs, etc. is good. But I have found too, for many of us who tend to feel, you know, let me live my life kind of thing. So a saving, or we could save towards vacation, you know, let me tell you, we could save towards vacation. Long before we retire, we know we're going to go on a cruise at retirement, and prior to retirement, we visiting, we holidaying. We Trinis tend not to wait until we wait until retirement, maybe for that cruise, but we don't wait until retirement and enjoy ourselves. So that is that's something we don't put savings contingency fund as a criteria, but we definitely put holiday for those of us who like our carnival and all that. I'm not knocking that, but we give priority to having fun, enjoying life. We live in life, and we are very scared. I think it's part of our human nature to even think of our mortality. When you tell me save an event of critical illness, an event of surgery, an event, nah, I don't want to hear that. I don't want to hear that. But when we reach this age, Terrian, and reality hits us, and we have friends, etc., we start to well, again, go into panic mode and wonder whether we have enough. So because of that, this is time for us, our 50 plus grouping, to take serious note on that. So if we haven't started putting aside, just as how we putting aside for all the other things to have fun, this is an emergency fund. And we can do it in a way too. Some of us may not be very disciplined in our savings. And we can look at the plans that, you know, you call for savings. Have a plan there that every month you're committed. So instead of your own personal plan, and you say, that is my emergency fund, and you use the emergency fund for your shortfall for the vacation or something like that. You linked your savings to a plan that you know you are guaranteed those funds in the event of emergency. And that is how I will swing it, you know, into that savings, into that in a plan for those who not very disciplined in their savings. Yeah.
Well, I would say flat to those who are not disciplined in their savings. Even if you get a diagnosis, panic not going to help you. You're going to be so if you are one of the persons who is not disciplined, the show is not for you.
I wouldn't say,
At this,
Kellyanne is the answer, but I just told you if you're not disciplined in savings, hey, I could share a little secret with you.
barbecue.
You have to do it, huh? You have to do it. This is no joking matter. This is a serious, serious matter. You have to change your thinking. You
Yeah.
have to change it.
And I really do believe that at 60 plus, 65, you get it in there where all of us, our friends around us, things are starting to happen. We, as we said before, we know it. So if we still have heads in the sand and we still thinking that not us, not this, not that, then go ahead, have a fine time. I have a perspective that there's emergency and then there is just not preparedness. And as we get older, we cannot afford to live a life where we just not preparing because we prefer to go down the fun road. I'm not saying not have fun, but definitely you have to pause and look at life and say, okay, what kind of contingency do I have? Even if it's a tiny, tiny contingency. And I am still in the stage of before a diagnosis, before something comes to you. That contingency can be used for so many things. It mightn't be you having the emergency, it might be someone else. But the fact that you have a reserve somewhere is something that all of us need to establish, even if this will be day one of your establishing that reserve. You can't go through the rest of your life as you age and have absolutely no reserve. That means you are expecting someone to take up the entire burden of whatever happens to you. And I think many of us will be disappointed if we continue with that perspective. So that's my note on the indisciplined people.
Yeah. And there is I use what my father used to say. There's this don't care attitude that you live your life, very freely and you don't care what happened. But let me tell you, and when that time comes and the persons you're depending on adopt the attitude that you didn't say, you didn't do anything, and I can't, not me, look elsewhere, it is too late for you to start thinking.
Yeah.
And, our age group also feels that, and I would say many in our age group feels that it's too late to start saving, that nothing can happen to me so far. I don't think anything going to happen to me. And what is the sense I starting to save now? And this is for you all who think like that. Let me tell you, you have to start now. And it's not about, yesterday, a friend relating to me a situation, and she's talking to this person who has about 8 children and looking for handout, etc., and receiving checks from the government under different categories. And she said when she worked it with her, there is enough money there for her to live comfortable. But yet she's complaining. And she said when she looked around and she looked at the same children who supposed to be disadvantaged, and she looked at what they were wearing, nothing about them in terms looked poor. And it's really about how we prioritize our lives. And I'm speaking to those of us who within our cohort, that age, that check yourself, what is really important to you? Instead of giving away that $20 or $100 to do extra, think that you can take that and put it aside towards your
emergency fund towards if anything should happen to you. And you may think $100 is nothing, but check how much you're spending per week.
Yep.
You know, a lot of these, sometimes you see the ads that companies break it down weekly.
Or
And they
daily,
tell you,
19
oh,
cents
yeah,
a day.
right. And when they work it out, it's easy. And these pay, how I see it is the, what do you call it, payment, the pay later part. I'm really out of it.
Mm.
They say, well, you know, this is what the fridge cost. But if you break it down and you pay,
Stuff like that.
yeah, the higher purchase, sorry about that. You know, this is what the item cost. But if you pay so and so weekly, within a year, you finish pay. And when you look at the weekly amount, it's like nothing. It's like a pack of nuts. You understand? And this is how I would suggest we start to look at how critical it is for us to save. And instead of looking at this figure and say, I have to find, when time come, I have to find 100,000 and I will never get that. Look at how weekly, because none of us knows. And let me tell you, if nothing happened to you, guess what?
You have the money?
Yeah, and the money, listen to me. All right. So I think we should break it down. And when we break it down, we would realize what we have to contribute every month, whether towards a savings plan, whether towards a medical, etc., that it is affordable, even for those who may feel they only on retirement at this time and the income is not big enough. It can be done. Let me tell you, it can be done.
Definitely. Definitely. Yes. So, Jennifer, we've talked about the indisciplined souls. We're not talking to the indisciplined souls. We're saying you have to get disciplined and you need to build a nest egg. We
Yes.
are at this 5.8 cohort. If you do not have a nest egg, the time to start building is today. Whether you are 50 or you are 80, you start building it today. You cannot have some news come to you and you just drop your hands with nowhere to start. That puts you on the wrong foot altogether. So, Jennifer, so now we get the diagnosis, we get the bad news. And the person needs $150,000 to start saving their life. And they're in full-blown panic mode. So they're not rational. They're all over the place. They're panicking. They're just not thinking straight. What is someone to do?
Well, as I said before, because we started with that, I started with the panic. Yeah. So you find a way to calm yourself enough that you could, to make the right choices. And if you are a person who always, a very nervous, hyper person, you find a family member or close friend who, can help you through this stage by walking you through the situation and who you're going to be honest with. Terry, and many times, we're not honest, I may say you give people the impression you may not want them to know because you're ashamed. Because they may say, oh, you had this big job, or you did this, or your husband was this, or your spouse was this, or whatever. I expect better of you. So their fear of being judged, they tend not to be honest and open. And if you start that plan not being honest, well, then you're not going to get anywhere. Right? So
but
the
I
thing
think there's
is,
two levels of judgment here because people are not honest and open because, number one, because you're in a financial bind, you don't want people to know that I can't afford to take care of myself, which is one thing. And then there is not being honest and open where you don't even want to admit that you have a difficulty, you have a situation, you have an illness, and you're hiding it. And sometimes the two of them clash and the panic just gets worse. because you're not
Yeah.
you're not being honest about, I can't afford this completely, and you're denying that you have a medical situation that you must attend to.
So before you say, listen, I don't have a cent, I can't do anything, look around and see. Yes, I always say there's always something you can do, Terry. I firmly believe that. There's
But Jennifer,
always a solution.
before we get onto that, I want to also stress the point you made, which I think is critical. Identifying someone who can walk this journey with you. And Jennifer, a lot of
Yeah.
times a person cannot be a family member, depending on your family dynamics. And it has to be someone who can be detached enough, impartial enough, not get, because as it gets difficult, family can get emotional. So I think
Agree.
that point that you raise of identifying someone who can walk with you and at least keep the emotional level is very, very important. Because sometimes it's you bawling and the person, your sister bawling, the mother bawling, the husband bawling, the child bawling, and nobody, it's just more panic.
Yeah. And Tarian, we have assets, we do have assets. Yes, and I'm not speaking to those who on level 0, because the levels you remain in level 0, don't care what, right? So I'm not speaking to you. You're speaking to the average person who worked, who may be still maybe getting NIS or small pension, or have something, some little something, all right, coming in every month. Let me put it that way, coming in every month.
Yeah.
Some maybe even getting, you may have some children or spouse who giving you a little thing, handing you something every month. So this is the time to gather everything, work it out. How many you're getting through charity, through retirement, through whatever. And you have that worked out. And then you look at situation. Many, let me tell you, Terry-Ann, and you know this, you may have acquired your home. You have your house. I'm not telling you go sell it. Huh? I'm just saying, look at the assets, because you may have some valuables within your home that you could look around and say, let me have a garage sale. Let me get rid of some of the things. Let me, certain, you have to think out of the box when you're looking for money in an emergency situation. Let me put it that way. Before you reach to having the barbecue and the fundraiser and the other things, they have a lot of modern ways now, the GoFundMe and all that. Before you reach there, asking for help on the outside, look on the inside, look within, and see what you have that you can access to give you help. And not just, oh gosh, I didn't have no cash in the bank. Oh gosh, that little bit of money coming in.
Mm-hmm.
And we already said that little bit of money, if you prioritize, could help in so many ways. Other thing, when we look at the system, and Terren, you mentioned at the last week's show that some of our beliefs in coaching, we say some limiting beliefs, that it is too expensive. Oh, go there. And I actually had someone sharing a story about a friend who didn't have money, went to the hospital, public hospital, and they told her the machines were down, but she can do these particular tests on the outside, get the results, bring it back, and they will be able to continue with her treatment and all. But they need these results. And her first thing was, oh God, that's why I don't like the hospital, etc., etc. And where she getting the money to do these tests without even knowing. And many times, Sarian, they don't even know. They haven't investigated where they can go for these tests, the cost of the tests, and why, if they get these results, they will get treatment much faster in the public service, But no, they shut down, blame the government system, blame all the reasons why they don't have the money and don't take action. And let me tell you, that action, that little bit of money you check in and you feel, oh, I only have a 500 or I could only raise 1,000, but they want X. That 1,000, Terrian, and from your investigation, plenty tests you can do with a $500. And then, and this is what we have to bring home, the awareness. They don't stop. You panic, you quarrel, you get anxious without being informed properly of what is out there. So that is, to me, that is critical in terms of you're in it already. What can I do? Hey, that's some real information, and you would realize that you can do plenty.
Yeah. Jennifer, I wonder sometimes if people deliberately use panic as a way of avoiding doing research and making informed decisions. So in panic,
I agree with you.
You can get plenty sympathy when you're panicking, Oh God, and you're dropping down, and it's all kind of stories about is this and that, no facts, no facts.
Give you handout.
Yeah, no facts at all, no research. You have no clue what this test costs, what this costs. You assume this about the hospital, you assume that about the private health system, and you're there thinking going down the road, throwing your burden on everybody else. And it is not that people are uncharitable, but you get so much more when first you can help yourself.
Yes.
If you see somebody panicking, they don't know the details about what their situation is. They don't know the details about the situation they have. They don't know the name of this and the name of that. But you come in to say, oh gosh, help me. Oh, this.
Yeah.
It makes no sense. It makes no sense. Yes, and you're very, very right. If now, even if something is thrown at you, and that again emphasizes why it's important to get that person to walk the road with you. It has to be a person. If you know you are a panic-inclined person, don't pull another panicking partner with you. No. Get somebody who's level-headed. And I would say, if you know you tend to be very level-headed and too cut and dry, probably you need to look for a panicking partner, because sometimes you may be too laid back. You may be too, cut and dried, and you need to get a fire under you. So know yourself and choose that person in that way. I would think for myself, if I were to choose somebody, I might need to have somebody who has a little bit of panic in them, because I would take things in a very logical and cut and dried, and I may not put urgency always where urgency needs to be. So those are the things I think that we really have to consider. And you talked, Jennifer, about information and how can you access emergency money. You see people doing fundraisers. You see people going to GoFundMes. You see people having barbecues. Yes, you have your garage sale. You have all these things. If you give yourself some time, they work. But I think they add more pressure to you and more panic to you, because giving up assets, giving up time, you have to ask for donations, you have to sell tickets, you have to wait. You have to wait for people to make up their minds to decide to help you, and you looking at $150,000, $200,000 and coming in chirp. After 3 weeks, your fund reached 10,000 and you still have another 190,000 to go. And the doctor says time is running out. You can't wait for those things. And we've had guests on from the insurance industry where we spoke about insurance being there. We pay in advance for the unforeseen and the
Yeah.
and Jennifer, sometimes we believe because we are over 60, we think that approaching an agent to get an insurance policy might be impossible. Now, if you have pre-existing conditions and all that, yes, you're going to be rated and all those kinds of things. But we've done some investigations, and it's not as expensive as we would think to get some critical illness coverage, which delivers a big lump sum to you once you have a diagnosis of something going, you know?
And Terry-Ann too, again, we speak about the awareness. It's just assume that you're too old to get any medical plan. You're too old to see about credit. You're too old. Go check it out. You have nothing to lose to check it out, to call. Again, I go back to what I said before, Terry. We have to remove this fear in us. We're afraid to discuss anything that associated with death, critical illness, even old age. We don't want to go. You know, people actually tell you they don't want to go there. I was speaking with not a friend, because I must say, and thanks again for those who have been calling and visiting and chatting. And in chatting, I was saying, you know what? I have to look at my situation. And they say, you know, Jennifer, what you most concerned about? And I say, my concern, if you ask me now, what you like is for the children. I have a thing about legacy, right? And and I don't want to go down. That is never enough. My legacy, I want my legacy to be huge. So I wish everybody could have, I could fix them with everything they need, right? Let me put it that way. So I was just saying that I really would like, if God said what you want now is not for me, you know, is the legacy for the children and the grand, okay? And I just mentioned that. And this was a guy I was speaking to, and he said to me, "You good boy, I don't think about that at all, at all, at all." I say, "So you don't think about if you die today or tomorrow, what you know, what you would like to leave for your children or what?" He said, "No, no, 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 no. I okay, you know, I okay. Whatever I have, they will get. But I want to think of death or nothing. You good, you good." And what he displayed there to me is what most persons, how they think and how they feel. And that is why they tend not to listen to an agent, give the agent that opportunity to discuss with them. Even, I'm not saying agent insurance, any type, even when they go to the credit union and the clerk there may say, why not look at the plan in case of death for your family or sickness and things. Just leave that out, you know, Terry, and they don't want to talk at all. And this is the time, and what we are doing here on our show is to open it up and say how important it is. You cannot leave it, because let me tell you, it don't have to be death. It could be a crisis like that, and your family in crisis too, because they don't know what you have, they don't know what to do, because it's not a discussion you ever had with them. It's not something is spoken about in the household at all. It's a shoo, right? And it's important for us to get these facts that yes, at 50 plus, yes, you could qualify for critical illness plan. Yes, you could qualify for medical. Yes, it is not that expensive as you think. You may be surprised if you work it weekly, put aside, you have enough money when the month and come to pay for a plan.
Yeah. Two things, Jennifer. One thing I know, someone who is not in a position to take care of themselves cannot and will not take care of legacy. Because if I can't take care of myself, I have a legacy to talk about.
Yes, some agreeing with you.
Yeah.
Some We're
Because
not talking to you.
legacy happens after I am okay, you know? And some of us sacrifice ourselves for legacy. And if we are doing that, then okay, you're saying if I get heart attack or cancer, leave me, let me dead. Don't try to save me. Don't take me to the hospital. Don't do nothing. Leave me, let me dead. Whatever savings I have, give it to the grandchildren, give it to the children. And I think that is a position some people may take. And then, okay, you know where you're going to end up. But if you are talking legacy, it means that you have prepared. And the person who tends to say, no, I'm not interested in that, is probably someone who is not prepared. Now, we wanted to get a sense of what does it cost? Because I look at critical illness insurance like this, and we're not selling policies for anybody to anybody. Are we looking at if I have a small nest egg, I only recently started savings. So, and I can't foresee in the next 5 years building up a significant amount. Then what am I to do? If I can afford, say, to save $600 a month, okay? If I save $600 a month and I do normal pigeon maths, okay, that's $7,200 a year. All right. In 10 years, I would have $72,000. Yes, you might have some compounding interest. Yes, you might get to about $80,000. All right. If I take that same $600 and I am reasonably healthy, do you know that I can purchase a critical illness policy that is valued at $300,000? So I save $600 a month to build up. Save $600. At the end of 10 years, I have $72,000, $80,000 with compound interest. I still have to have the barbecue and the GoFundMe if at the 10th year I get a diagnosis, because it's just not enough. But it is possible for a person who doesn't have pre-existing and so on, with that $600 to get $300,000 critical illness policy that is going to be paid to you on diagnosis. Now, if you're overweight, smoking, you this and that, either the amount that is insured, that is covered, will be less, or the premium will be higher. But I think that brings the fact that we have to broaden our scope as to what can we put in place to be reasonably prepared, so that if an emergency comes, okay, I have a little illness thing, you do it for 100,000, at least I get a start with the 100,000. All right. Yeah. You are likely to get a head start. People see your effort. So when you have to have the barbecue and the GoFundMe, somebody will chip in and they'll say, okay, come and go. But we won't find out unless we let ourselves get access to information.
And you're quite correct, Terry-Ann, but the other plug I would put in there too, it's all well and good for us to see we saving, let's say 600 or 500 or whatever we saving for that. But many times you reach 10 years, but then at the end of the first year, sometime when you see that money, you're committed and you're saving. If you're not disciplined, that money being taken out to go somewhere else, you know. But when you commit it, and that is why I guess you have insurance and you have these plans, it's about the commitment to pay it and their commitment, because you're taking it for a specific reason.
Mm-hmm.
Right? Because when you have, and we agree with savings, so you have that saving. But if you feel, okay, this savings here is in case I get sick, nothing written across that saying that do not touch unless you get sicker. So you tend to interfere with it. So you just have to look at the balance. Yes, yeah. You save one, you said a little bit counts. You have a little bit there. So when time comes, it may not cover your whole if it's 500,000 or what,
Mhm.
but it would reduce it significantly. So as you say, if you have to raise funds, you don't have to raise that much. And
Correct.
again,
And they get a head start.
and those who are more sympathetic to your cause and want to contribute would do it if you know you weren't just sitting back enjoying life. Because some people say, no, I'm not putting no money there because I see them enjoying life, having a good time all the time. They didn't know all the time about savings. I have been saving my little money. Now they want mine. You have to be careful, with that. So, yeah, and I want to point out, you mentioned the average cost there on insurance, critical illness. But Terry had also did some investigation and we looked at the costs of doing like just the x-rays, blood tests, etc. And I have seen recently, especially as we just came off of this cancer society, the cancer month with all the different ads. And I have seen a lot of the medical facilities sort of piggybacking on those ads, advertising a lot of different package. About 3 different medical services I've seen where they have these packages and they cover all the essential type of tests that you may need. The CT scan, the X-ray. This has nothing to do with cancer. This is just a
Medical,
like
well-being.
and they have it in packages where you could do the complete thing, you can do part, and when you look at the total cost, Tarian, it actually averaging just about $500 and you're getting the blood test, this done and that done. And obviously, when you do that and you go, because it comes with a medical check, they can take it from there and say, okay, these are the things I recommend, but you don't have to do all one time, and you can do that. For those who don't have a medical plan in place, don't plan to put one, but see the importance of doing these tests. You have the packages there, and they're all reputable service companies, medical companies that they can do those tests from. Yeah.
Jennifer, and I will tell you also, there are the packages. And last week we talked about me going to do my medical. Okay?
Yeah.
And I've done so. And I want the whole hub because, just now I say I'm practical, well, kind of extreme, all right? So, a full barrage of blood urinalysis, in total, it was about 37 different tests. They got tested for everything. And at the lab, for all my bloods and my urinalysis, the total of the tests was about $3,200. But with my trusty TAP card, I got a discount and it was $2,800. Tomorrow, well, this week, I'm going to do my chest x-ray, my abdomen scan, my pelvic scan, my breast mammogram, and digital ultrasound. And those are going to be $1,100. All of that going to be $1,100. So 28 and 11 is 39, say $4,000. $4,000, and this is a test that I do every year. I have not, my medical insurance has not kicked in as yet. So I'm saying leave it be. Even if you don't have a lump sum, if you're going to be living off the seat of your pants, at least have in your mind your risk. At least have in your mind your risk. And I'm saying, if you're living off the seat of your pants, you could allocate, say, over the next 5 months, the next 6 months, to get these full tests and scans done, to at least make sure that you know what your health situation is at this time. And again, every 2 years.
And you also important, Tarian, without the medical plan, you have an idea of the cost. You could break it down.
It will go down. It will go down.
That's showing that the importance to also for those who would be thinking, why have a medical plan? With a medical plan, those costs Terry I'm talking about at the end of the day when she makes her claim would be
Covered.
reduced.
A significant percentage, I will be reimbursed. And the thing about it is that is really on the extreme end because I am nitpicky like that.
Because
I want everything. Yes, everything. My doctors, I said, no, I want this. She said, but we don't have to do that. I said, I want both of them done. Everything. So I was ridiculous. As I said, they took 7 vials of blood from me to do all the different tests and then go to do all the scans and stuff like that. But I would blow $5,000 in this year between going out to dinner, going to shows, buying clothes, buying shoes, eating out and stuff like that. I would have to compromise on all those areas. Taking a little bit from every one of those expense buckets would give me, without insurance, I'm assuming that I have no insurance and everything, would give me the roughly $5,000 I need to understand what is my status. And if my status tells me I'm fine, then I go live off the seat of my pants for 2 years again.
So much, that peace of mind, it makes a difference. I also want to add, I put a plug for the clinics, that for those who may sit back and although what Terry Ann has outlined here sounds quite reasonable, and it might have those who may sit back and stay still, that is plenty. Please note, you can go to the clinics. There are a few of those tests you may not get, but think about it. There are many of those tests that you can get at the clinic. You join the clinic because we are that age. So you have all reason you can join the clinic. You do that full medical. The doctors will check you out and recommend, based on their findings, recommend certain tests. And there may be a few that, yes, the machine may not be working or whatever reason. But think about it. You can do it on your own and it's less than $500. Seriously.
The point is that we have, and I say this because our time is running out, we have to come out of this ostrich mode where we avoid finding out. We have to be proactive. We have to invest a little in ourselves. And whether we invest in money, we invest in time, because if you go to the clinics, you're going to spend time. You have to invest in yourself and know what your status is, because that's the only way you will prevent yourself being panicked and making crazy decisions if some bad news comes to you sometime in the future. Yeah?
So true.
Yeah. So Jennifer.
Check your situation, put plans in place. You're not putting plans in place to die. You're putting plans in place to live.
To live. To live. Right? Definitely.
To have backup, so you'll feel much more comfortable. It will reduce that panic. If that time does come, you could take it with ease. You won't be panicking. So I hope you really, take note of what we have said here and take action.
Great. Yes, Jennifer. So,
yes, last week I mentioned that we could still have some celebration for Christmas, and we can do that online and have everybody come together. So we decided we have the date is Friday, the 13th of December. We are using our Zoom platform, so it will be from 3 p.m. to 6 p.m. You can invite your besties. If you don't want to invite nobody, come take a drink with us, But so we each will be, it could be at your own home. You could have a little friend line. So somewhere create a pod, and we're going to be having a good time. So our recommendation is listen, create that nice festive spot wherever you want to have it. Have some friends with you. Do all your what you do for Christmas. So you have all your ham, your turkey, whatever you want to serve. You know, we have some very good cooks and people who love the kitchen. Do your own thing. And just, you know, we're sending out the Zoom link, and you just click, and we all will be in this party together, enjoying ourselves, singing, dancing, waving, doing a little, you know, having fun. So noted, Friday the 13th of December from 3 to 6, all our 5.8G tribe on Connections 50 Plus Zoom platform. So it's a Zoom Christmas party. Yeah.
Great. So you'll hear more about this as we go on. So see you then. Take care. Bye.
50 Plus Tribe and followers from Trinidad and Tobago and the Caribbean.
Thank you for joining us on this Connections 50 Plus 5.8G Alive show.
We hope you enjoyed the lively conversation and look forward to seeing you next week.
Don't forget to like our Facebook page and subscribe to our YouTube channel.
We really love getting your feedback. Bye for now.